Division of Human Services block grant hearings. And we're going to get started in a moment, but this is really just a technology check to see, can the individuals who are in the virtual room hear me? If anyone can respond, that would be great. And you can unmute yourself.
Yes, we hear you.
Oh, fantastic. Okay. And you can see them, Shelby? All right. Great. Okay, so Shelby, if you want to start the recording for our hearing today. Okay. All right. Great. So again, good morning, everyone. My name is Rachel Neff, and I'm the Director of Human Services here at Bucks County. And we're very happy that you decided to join us for our public hearing this morning. This is being recorded, and it will be posted to our Division of Human Services website at the conclusion of the hearing. So as we get started this morning, we have a lot of information to share with you over the next hour and a half. And before I walk through the agenda and make some additional comments, I wanted to make sure you knew who would be speaking with you this morning. So we are going to go through the presenters, and Donna. Share the mic.
Good morning and welcome. I'm Donna Duffy Grimm. I am the Administrator for Behavioral Health and Developmental Programs.
Diane Rosati, Director of Bucks County Commission.
Hi, I'm Erin Lucas. I'm the Executive Director, CEO of the Bucks County Opportunity Council.
Katie Morseglia, I'm the Coordinator for the Bucks Human Services Hub.
And Amy and Jen, can you introduce yourselves at the mic as well, please? Thanks. Okay, thank you. And I would ask anyone, if they're online, if you can mute yourself, and then when it's time for public comment, you're welcome to unmute yourself. Okay, great. So you know who you'll be hearing from this morning. And just some logistical items. Anyone who is joining us virtually, if you could please be sure to, as it asks on the slide, put in your name and contact information so that we can keep track of who's here with us this morning. And I do appreciate, I believe everyone who's in the room physically today has signed in, because we do want to keep track of who's present. And then anyone as well, when we get to public comment, these microphones, they just have an on and off, so please be sure to make sure it's on green when you're speaking. Are there any other logistical items that I am forgetting, Shelby? Okay, great. So I just wanted to walk through what our agenda is going to look like this morning, because we do have a number of presentations. So following my introduction, there will be an opportunity for public comment where individuals are welcome to share comments about the thoughts that they have related to our block grant. And then this year, we're doing things a little bit differently for those of you who've joined in the past. We're going to talk about, again, there's so many ways that this block grant supports individuals across Bucks County. And we're going to spend a little bit of time this morning really talking about housing challenges in Bucks County and what the response looks like collectively from a number of different, county departments as well as community-based providers as well. So you'll be hearing from Katie Morseglia, Erin Lucas, Diane Rosati, and Donna Duffy Grimm around those items. We then wanted to be sure to spend a little bit of time going over the financial picture of the block grant. So there's a little bit of time that we'll be talking about that, and that's why we're glad that we have Amy Crossan and Jen Landis here to walk that slide through for us. And then since there are really two departments where this block grant supports a lot of work. And so you'll hear again from Diane Rosati from the Drug and Alcohol Commission, and then you'll hear again from Donna Duffy Grimm around how her department, the various initiatives that the block grant supports. And then finally, we're going to wrap up by talking about integrated initiatives that we're moving forward here in Bucks County. Some of these you may have already heard about, but we're going to talk about how there's, again, multiple departments that come together to support these initiatives and multiple funding streams, clearly the block grant being a significant one. So, and then at the end, we'll have another opportunity for just some final comments and wrap up. So again, thanks everyone for joining us. And I just wanted to make a few more remarks. So again, our Division of Human Services, we support thousands of individuals every year, and we do this through our Children and Youth Department, our Area Agency on Aging, our Human Services Hub, obviously our Behavioral Health and Developmental Programs Department, the Drug and Alcohol Commission, and our Human Services Co-Responder Program, as well as Veterans Affairs, which came under the Human Services umbrella about 2 years ago. And we also work in partnership with so many community-based organizations, which is why I'm always thrilled that we have Aaron Lucas as a presenter for our block grant hearings, because Bucks County Opportunity Council is just one of so many valued and important providers that we work with across Bucks County. And I also want to recognize and appreciate at the county commissioner level and county leadership here in Bucks County, there's a significant deal of support around the work that we do in human services. So I am very appreciative of Commissioner Marseglia, Commissioner Harvey, and Commissioner DiGirolamo, as well as our Chief Operating Officer, Margie McKevitt, who really support so much of the work that we do every day. As I've shared in the past, the Human Services Block Grant is approximately $33 million. This is a block grant that we received from the State Department of Human Services. And we are invited to apply for this grant funding. And actually, it's quite timely because just on Friday afternoon, the state released the program guidelines for the upcoming block grant. So we will be working on that over the summer. We are required to hold public hearings per the block grant requirements, and we will be submitting our block grant in early August to the state. So again, these are funds that come from the State Department of Human Services, and they're administered to counties with the expectation that we are aware of what the needs are in Bucks County and that we should appropriate them as we see fit, obviously gathering feedback from community partners, doing needs assessments, and being sure that we're being responsive to community needs. So I also think that these public hearings, and I'm really glad that everyone showed up in person today as well as virtually, I think they're a reminder, and I think those of us who work in the division are reminded every day, but how much need there is in our community across such a variety of areas. And I think that it's important for us at the county leadership level to be in communication with our partners and providers about what's happening and to hear directly from the public about what those challenges are. So with that said, I think that this is a good segue to welcome anyone who would have public comment this morning. You're welcome to come up and share those thoughts with us. And again, I think for the purposes of today's hearing, we want to be able to hear what's shared and continue to be in dialogue with you. And if we cannot continue the dialogue in today's session, like I said, we are working on the block grant over the summer and we'll be submitting it in early August. So with that, I would ask, and what we'll do, if there's anyone in the room, I'm going to invite individuals to come forth in the room first. And then for anyone who's virtual, if you would please raise your hand or indicate in the chat that you would like to make public comment, we'll be sure to have your voice heard. Okay. All right. So at this time, is there anyone who's in the room that would like to come forward and make public comment? Great. And so please come, you can come to the front, and Muriel, and then the microphone, it just has to be clicked on green for comments. Okay, thank you.
I didn't hear an echo. Should I start over? Okay. So Muriel Kelly with Family Service, Director of Housing Services. Um, we oversee a homeless shelter in Bucks County. It's one of the only homeless shelter that serve everyone, meaning singles, families, kids, the elderly. And what we need is assistance from the county to be able to operate the shelter, meaning that we need more financial assistance. We're always operating at a loss, meaning that the agency Family Service is taken away from other programs to be able to service the shelter. The shelter is a county program, meaning that it's serving Bucks County residents, um, residents that are vulnerable, that needs assistance, and if we're not serving them, they are on the street. I know we have various different programs in order for us to do our job as a partner, from a street outreach team, all the other services, but when it comes to the day-to-day operations of serving individuals who are homeless, and I wish I can tell you that homelessness was the only issue, our clients have high barriers. So we have a team of case managers, about 4 of them that are servicing. We have a team of about 17, about 30 staff that operate the shelter. It's 24 hours, meaning that we can never close. From holidays to summer, we are open. So we constantly need staff to be there on hands. And the fact that they are also high barrier with mental health and substance use issue, the behavior sometimes can be an issue. So we do need staff on hand to be able to service them, to be able to respond to issues and crises. And for us to truly do our job, we definitely need adequate staffing, which we cannot cut, but funding will be a great tool for us to be able to operate the shelter and not only serve just providing a cot and a meal, but we do so much more than that. We provide case management, we have referral, we work with a team of staff, and ideally having additional funding to operate a government service program will be what we need to truly be successful in our endeavors. Thank you.
Great. Thank you, Muriel, for being here and sharing those comments with us about the shelter. Is there anyone else in the room, the physical room, that would like to make public comment? Okay. So virtually, Shelby, is there anyone who has indicated they'd like to make public comment? Okay, so my mic is on. So in the event anyone is on virtually who would like to make any public comment, you're welcome to unmute yourself and share, and we'll just give it about 5 seconds. Okay, and there will be an opportunity at the conclusion of the hearing as well. Okay. So with that said, as I mentioned in my earlier comments, one of the opportunities that we get as a county is to determine how we're going to use the flexibility of the block grant funding to help benefit individuals, residents in our community. And one of the initiatives that we started a couple years ago was our Human Services Hub, and I'm going to move it over to Katie Marseglia to talk about that.
Yeah, so just a brief overview of the hub. The hub began in February 2021, so we're a baby agency. Thank you. I forgot about the clicker. Just give me one moment. Okay, so we're under the Human Services Department. Our goals essentially are to provide personalized navigational tools to individuals seeking help within the human services field and community. So whether that be housing, mental health supports for older adults, really anything anyone needs within human services, welfare, things like that. We most of our business is done over the phone. People call, we follow up with them multiple times to make sure that they're getting what they need. But essentially our overall goal is to connect people to those vital resources within the community, which is helpful in preventing a number of things, including children and youth involvement, criminal justice involvement, things like that. One important thing we do is we do track all of our data, which can be helpful in informing future programming. And like I said, we are a little bit of a baby agency, but I will tell you a little bit more about our stats. In addition to the navigational piece, a lot of what the hub does is communicate with community-based organizations, nonprofits, faith-based organizations to coordinate services and make sure our most neediest clients are getting served appropriately and have connected with the appropriate agency and services. So attending a lot of community-based meetings, seeing what the need is really, and advocating that need for our clients. Okay, just some things we can help with. General navigation. We like to goal set with our clients and facilitating collaboration with a number of different agencies. And again, mental health, substance abuse and treatment referrals, older adults, disability services, welfare, housing, and a lot more. Okay, and just a couple things we do. We receive official referrals now from adult probation and parole and children and youth, in which we conduct outreach, we set goals, we follow up, we collaborate, and we advocate for them. And this is a new thing that I think will be very helpful for our families most in need and involved with county agencies. We have an official partnership with Doylestown Fish. We work collaboratively with them on their shelter, triaging their shelter referrals. They're a large agency serving the Central Bucks community, those experiencing homelessness and housing insecurity. So we help support that effort. And as of recently, we are trained in Housing Link and coordinated entry. So if need be, instead of telling people to call Housing Link, we can in fact perform those intakes and referrals as needed. Okay. And I'm so glad Muriel went first, because a lot of what we do is housing and homelessness. And I didn't know that when I started, when the hub began in February 2021. Wasn't sure what people would need. And it's housing and it's homelessness assistance. So we've received about over 7,000 calls since our start, which is a lot. We track right now 36 categories. So it's 36: mental health, drug and alcohol, housing, income assistance, immigrant rights, things like that. Housing and homelessness is always number one, and we have that at 23%. That's out of 36 categories. That's huge. That is mainly what we do. We have our physical office, which is right next door at the county administration building. 90% of our walk-ins are those that are experiencing literal homelessness. There's just not enough need to keep up. There's not enough support to keep up with our need, essentially. And that's what the hub would really like to advocate about, is housing and homelessness services, particularly for populations that struggle with mental health, drug and alcohol, and co-occurring. If they don't have one, there's another. It's a complicated issue and it needs attention. And the hub, that's what we do. We know almost every time someone calls, this is going to be housing. We could almost bet on it. Okay. And then the second most reasons for calling, or why people contact our office, is they do believe we are the county assistance office and they need help accessing mostly Medicaid and SNAP. There's a little bit of a difference that we do like to track, because there's some that call and say, I need help applying for SNAP, which we're happy to do with them. They can come in, schedule an appointment, we can talk them through the process. But many people do think we are the county assistance office, because when you Google PA Department of Human Services, Bucks County comes up, and that's a lot of what we deal with. So again, 14% out of 36 categories, that's a huge amount. So the need is huge for healthcare and food stamps. And then we have utilities and bills. People needing to remain at home by keeping an electric bill on, things like that. Mental health supports is a huge one. Locating and obtaining and continuing mental health treatment is very difficult, can be very difficult. So the hub tries to help these individuals by performing extra follow-up, because it can be difficult for these individuals to make their own outreach calls. It can be difficult when you call the hub and we maybe need you to call somewhere else. Maybe you only had one call in you for the day. So that's another thing that we do and want to support. And then aging and older adult services. We'll go over the pick count in a moment, but you'll see there's a huge rise in homelessness among older adults. So we help a lot with that. And the top agencies the hub refers to is the County Assistance Office, number one. Like I said, people do think we are the County Assistance Office. And we do a lot of collaboration. We do not just send people there. We have a liaison that we work with, and we can work with people to do applications in the office. And then the Bucks County Opportunity Council, number 2, housing and homelessness, like I said, can't harp on that enough. And with the utilities and bills aspect, we are redirecting to street outreach workers, or we're referring for eviction prevention or utilities assistance. And then, of course, the Bucks County Housing Link, which is, if people don't know, the triage intake center to obtain housing and homelessness assistance. So that's really, for the hub, the order of the day, what we do. Welfare benefits, housing and homelessness, and much more, but those are our top priority or top issues. And then the point in time count of 2024, which was conducted in January of this year. Just very quick overview. Okay, so we had 407 people were counted experiencing literal homelessness. So that means outside, in a shelter, in a motel not paid for by charity, or in a place not meant for human habitation. That's a 27% increase from last year. 27%. Huge, huge. 70 chronically homeless. That's a 67% increase from last year. Even bigger, right? And then we can see where people are sleeping, mostly in our shelter, right? Yes, mostly in our emergency shelter. Again, we had 42 people indicating they needed emergency help. Notable trends, there was a 66% increase in those reporting a serious mental illness, a 66% increase. That's more than half. Again, and a common misconception are these individuals, especially in Lower Bucks, are from Philadelphia or another area. We can see 9 out of 10 people are Bucks County residents. Okay. Just a couple more special populations. Most seniors who are experiencing homelessness are not connected to services. And if we jump down a little bit, we can look at chronic substance abuse disorder, serious mental illness. Again, the vast majority of our populations, the Housing Link and County Homelessness serves are those with serious and persistent mental illness. So that, again, is a priority. And again, we'll see the code blue jump back in 2023. We had 105 people at Code Blue. We had 173, which is a huge increase, and we've seen a huge tax on our Code Blue providers this past year. Okay, so I don't mean to bring everybody down, but thank you for listening. I don't know if we're taking questions, or should I just pass it to Erin?
Thanks, Katie. I think you can pass it along to Erin. And I just wanted to, again, recognize and appreciate that FSA's partnership with the response to individuals experiencing homelessness is very critical for our community. I think just looking at these increases, the 27% and the 67%, I mean, this is a real issue for us in Bucks County. So with that, Erin, I know you're going to be talking about our homeless assistance program response.
Thanks, Rachel. Thanks, Katie. Okay, a little bit about the homeless assistance program, or otherwise known as HAP. First, let me talk a little bit about BCOC. We're the designated community action agency for Bucks County. We are a nonprofit 501c3, not a government entity, but we closely partner with the county. Our mission is to reduce poverty and partner with the community to promote economic self-sufficiency. And we have about 65 staff in 5 locations throughout the county. We do serve all of Bucks, from Quakertown down to Bristol. Last year, we served about 56,000 people in 5 program areas: food, weatherization, volunteer income tax preparation or assistance, economic self-sufficiency, and our housing programs. So what is HAP? The Homeless Assistance Program helps Bucks County residents who are homeless or facing the threat of eviction. The goal of the program is to quickly connect people to housing assistance and help them move towards economic self-sufficiency. People must be able to pay future rent to receive this funding. And for Bucks County, there are 4 components: the Housing Link, case management, rental assistance, and the Bridge Housing Program. So first, a little bit about the Housing Link. That's okay. I can't read that tiny print, so. First is the Housing Link is the centralized intake and coordinated assessment for all housing-related crises in Bucks County. It is a collaborative approach to helping people resource and resolve their housing issues, as well as eliminate duplication of services and streamline access to shelter services. Uh, this past year, since July 1st of 2023, 1,766 households were served through Housing Link's housing planning program. That's the portion of the Housing Link that BCOC operates, the housing planning. We operate 3 housing resource centers located in Quakertown, Doylestown, and Bristol, and then there's a satellite in Warminster. Funding for Housing Link comes from a variety of sources, HUD, PHFA, CSBG, that's the BCOC's block grant, and then the Human Services block grant. This past year, we continued to administer the BERA program, which is the Bucks Emergency Rental Assistance Program, with support from the county's housing department. The BERA program served over 6,000 people, 6,000 households, I should say, not people. And then Family Service operates the call center of the Housing Link. I do not have the numbers off the top of my head, but it is a lot. Muriel, how many is it? Calls. Right. Right. Very intense. If you could not hear Muriel, she said there were 3,000 calls a month to the Housing Link call center, and the calls are getting more intense. The people are further in crisis, especially since the Emergency Rental Assistance Program ended. Although it is starting back up briefly, hopefully this week. The second component is case management. Case management is designed to guide, coach, assist families in identifying solutions and strategies to resolve their housing situation, to work on more long-term goals towards self-sufficiency through our economic self-sufficiency program. The services offered under case management include budgeting. That is a huge piece of helping someone maintain and keep their housing, helping people understand to pay rent and utilities first before they pay anything else, landlord negotiation, employment assistance, and referrals to community services. I think what BCOC coaches are seeing in housing planning and what Family Service call center people are hearing is that it's not that necessarily that people don't know how to budget. It's just right now that they just don't have sufficient income to pay the high rents in our county. And so that's what we're hearing a lot of, is that, you know, people are paying 50% or more of their net income to rent, and there's just not enough income. The slightest crisis or mishap, something that happens that throws their budget off and they're unable to pay the rent. In case management through the homeless assistance program this past year, so far we have served 375 households, 822 people. The next piece of this of the HAP program is rental assistance. This is to assist people who are either facing eviction or who are currently homeless and are looking for assistance to move in. The assistance around the homeless assistance program, around the HAP program, is very limited. It is $1,000 for people without children, so for individuals or households without children under 18, and $1,500 for families with children under 18. And these amounts are available only once in a 24-month period. So for as long as I have been at BCOC, and that's a long time, 24 years, those have been the numbers. They have not changed. It has been $1,500 for families and $1,000 for individuals once in a 24-month period. In the early 2000s, that went really far. You know, rent was $700, $600, but now it is rare for us to have someone walk in our door with rent under $1,500. So the money doesn't go very far. This year to date, we have served 165 households with 330 individuals. The average assistance that we have utilized is $1,177. And mostly that is because 79 of those households were without children, 86 of the households were with children. And what we do is kind of cobble together multiple funding streams to make it work. As Bear has come to an end and is supposed to be temporarily open today, but we are waiting for the funding. So it should hopefully open sometime this week for a brief period of time. But as Bear came to an end, we worked with the county and some private resources to increase rental assistance amounts for eviction prevention and move-in assistance to $3,000. So if someone gets referred to us through Housing Link to our housing planning services, we will start with what is it that someone needs to either prevent the eviction or move in. And hopefully we'll be able to use a combination of HAP and other resources to make sure that someone can stay where they are. So the next component, the last piece of the HAP program is the Bridge Housing Program. So Bridge is a transitional housing program designed to help homeless or unstably housed families with children connect to permanent housing and receive intensive case management services. That program serves 10 to 15 households at a time, and it's rolling. So as families graduate or move on from the program, maybe move into another program, new families are enrolled. Case management funding is provided by Bucks County Children and Youth, while the rent is paid through the HAP program. And typically we're able to help families up to 18 months in that program. The goal is we help someone who is homeless or very unstably housed. They have to meet the Human Services definition of homeless, which means doubled up less than 6 months, or are literally homeless in the shelter or hopefully not on the street, as that's not ideal for families with children. But we can help people for up to 18 months. And what we do is help them move into their own permanent housing. The lease is in their name, not in someone else's name. And during those 18 months, the intense case management that is done through BCOC and the Bucks County Housing Group is to help people stay housed, maintain that housing, and not have a future crisis. So eligibility for the Bridge program includes involvement with children and youth, at least one child under 18 in the household, and they must be under 200% of the federal poverty guideline, have a housing crisis, and be a Bucks County resident. And those are the eligibility requirements for that program. All right, and that's it for me. And to Diane. Thank you.
Thank you. Good morning, everyone. Want to thank everybody for being here too. I wanted to share that the Drug and Alcohol Commission, like the Opportunity Council, is also a 501c3 nonprofit organization. But as you know, we work very, very closely with county government and are happy to do that. I want to share with you some information about our housing efforts. I think the theme that you'll hear, or that you've already heard, is that I think Erin said we're cobbling together our funding, and that's exactly what we're doing. So we're trying to do the best that we can with the funds that we have to provide services to residents. And the piece that I'll talk about is for folks who have substance use disorders. As you know, as you've just heard, the cost of living in Bucks County can be extremely high. And so folks who have a substance use disorder may have not the ability to return to their homes once they've left treatment. They may have burned every bridge and don't have the supports that they're hoping for in the community. And so finding housing is critical to provide safe, sober, supportive housing for those residents. And that's what we aim to do with what we have, and that is some braided funding. The first that I'll talk about is a funding project through Bucks County Behavioral Health Developmental Programs through reinvestment through Health Choices. And that is a significant grant. We have one housing coordinator for a project that we call BC ROC, that's Bucks County Recovery Residents Oversight Committee, where we provide recovery housing for Bucks County residents who have substance use disorders, who are motivated to enter a licensed recovery house in Bucks County. Bucks County, as you know, is the home to probably several hundred varying levels of sober and recovery housing, but only a smaller number of licensed recovery houses, licensed through the Bucks County, through the Pennsylvania Department of Drug and Alcohol Programs. And those are the houses that we contract with. So we have 35 houses in our network in Bucks County that are licensed. We've seen a very significant increase in requests for recovery housing in our county, and we're able to provide 1 month of free, no-cost recovery housing to residents, and then an additional 2 weeks. So the first month is free, the second month is at 50%, and then the idea is that the resident will be able to fund their own recovery housing. A recovery house is licensed in the county and provides certain number of meals, meetings, community-based meetings that might be mutual aid, support, safety, urine drug screens, medications are prescribed to individuals, but they're self-administered and kept under lock and key, of course, at the recovery houses. And we provide significant oversight for those houses. We contract with them. We also do announced and unannounced site visits to recovery houses. So over the last year, the current fiscal year that we're in now, to date, we have provided 398 Bucks County residents with recovery housing. And that's a significant number, especially when we look at the prior year, which was 324. So we have about a 23% increase in residents that we're funding in recovery houses. We're so proud of this project. It also has a component that we know is important to everyone, and that is we want to make sure that it's an effective program. So we have an annual evaluation that's conducted of this project. And I want to share with you some of the highlights, just a few of the highlights that are really important because they impact all of us. The evaluation of this past year showed that 89.2% of individuals agreed or strongly agreed that they were regularly participating in recovery meetings. That's a 78% increase over the prior year, which is certainly significant. 75.7% of those individuals reported being employed either full-time or part-time, an increase over the prior year. 89% of those individuals reported no incarceration since the end of their program. 95% of the respondents agreed or strongly agreed that their value in society had increased compared to 87% the prior year. And lastly, 93% agreed or strongly agreed that they can take care of themselves compared to 84% last time. So important that we not only fund the projects, but that we take a look at the measures to make sure that individuals are not only progressing, certainly not only satisfied in the projects, but that they're effective projects that we want to continue to fund, and certainly we do. As I mentioned, we're braiding our funding sources. The project that I just spoke about was through reinvestment, and this new project is through a state opioid response through one of our larger funders, and that's the Pennsylvania Department of Drug and Alcohol Programs, in addition to the Human Service Block Grant. And that project started in the 22-23 fiscal year. In that year, we also funded 10 individuals in recovery housing and 2 individuals in independent housing. This is a different project. I spoke earlier that our reinvestment project funded about 6 weeks of recovery housing. This is a longer term commitment. So this is 6 months of recovery housing for individuals in Bucks County. And we also expanded to lease arrangements, which have been challenging to locate, but our providers, our Family Service and St. Luke's Penn Foundation are working really diligently to obtain those leases on behalf of individuals. So we certainly increased in the next year in 23-24, our current fiscal year, where we've funded 35 individuals for the 6-month recovery housing and 16 independent lease arrangements. The only other item I wanted to share is it's so important to not just fund the service, of course. We want folks to be in recovery housing, but we're also ensuring that we're funding case management for individuals, check-ins for individuals at the recovery house. They meet with our recovery house coordinator, develop a recovery plan. They can contact that individual if they're having any challenges with the recovery house itself or with their treatment. So we're providing sort of a team approach that we had not provided in the past, and that seems to be working really well. So that's it for Bucks County Drug and Alcohol Commission and our housing impact.
Should I start over? Okay, I'm sorry about that. The one thing I was supposed to do was press the button. Okay. All right. I apologize to people in the room. So I do, Amy and Jen are going to be talking about the overall finances of the block grant. But while we're talking about housing, I do want to talk about the money that comes to behavioral health and developmental programs, as I do every year, in terms of our MH allocation. So for this year, we were allocated about $21 million in terms of mental health allocation, and $13.9 million of that is being directed toward housing in the community. That's about 58% this year. The slide talks about an average annual amount of 50 to 55%. That is what we had been trending, but this year it represents 58% of all the monies that we have for mental health going towards community housing. As Muriel has said, and everybody up here has said, none of the levels of service in the community that are represented on the right there reflect emergency housing. So none of the monies reflect money from our department going to emergency shelter, but we do need places for people to go from the shelter. And we need longer term mental health supports for individuals in housing. So we are able, with our $13.9 million, to support about 309 individuals through various levels of support in the community at any given time. What I am hopeful for this year, I don't know if folks have heard about the 1115 waivers that have been submitted by the state to the Centers for Medicare and Medical Assistance Services. One of the major waivers that was submitted has to do with homelessness and individuals who have housing insecurity. A piece of it is about connecting people with resources, but also providing resources through medical assistance for things like rental assistance. So I am hoping that this is going to open the door for a paradigm shift. One of the reasons that through the block grant that we give so much money to community housing is because there is no other funding source that we have here at the county that pays for room and board at all these levels of care, or pays for non-treatment mental health supports, such as caseworkers and things that are not clinical. So we are the funding source for community housing. But with these waivers, I'm hopeful that that will shift and that medical assistance will be made more flexible for medical assistance to help with some of these expenses, thus freeing up our block grant funds to do more around other sources, and especially around emergency shelter services. So more to come on that. Of course, it won't be here fast enough. It's still at the conversational and negotiating the application that was submitted, but it does occur in other states. So there's this is not pie in the sky, so to speak. CMS is very open to this for Pennsylvania, but they're working out the details of the language and the budgeting for it. Everybody has talked about trying to braid funding. Again, we are trying to do that as well around housing. So we do have a master leasing program that is new, that is being piloted through a Health Choices Reinvestment grant. We have selected a provider for that, but we are in the final contract negotiations, so cannot make public that provider. But we're very excited to get master leasing off the ground. It's a 5-year plan, and over that time, we're hoping that about 30 to 40 individuals will be able to be supported with rental assistance and mental health and or substance use supports in that program. Okay, I think that's it for housing.
Great. So thank you, everyone. Thank you, Donna, for your comments. And again, we wanted to just take some time this morning to really recognize the housing challenges here in Bucks County. So I'm hopeful that you heard some takeaways from this presentation this morning. And with that, I think one of the challenges we have in administering our block grant is determining what initiatives do we fund, because there's so many competing priorities. So I'm going to turn this over to Jennifer Landis, who is the Fiscal Director for the Behavioral Health and Developmental Programs Department, and then Amy Crossan, who's the Finance and Admin Manager for Human Services.
Hello. So as you can see from the slide, and as was mentioned earlier, the block grant is about $30 million, or a little over $30 million the last 3 years. The funding has been allocated with mental health at 70%, ID at 22%, homeless assistance and HSS at 1%, and drug and alcohol at 6%. And I think one of the themes we've heard today from just about everybody is that the biggest challenge is flat funding. We only get so much funding from the state, and as we all know in our personal lives, like the cost of everything has gone up, right? I mean, nothing gets cheaper. So the same amount of funds has to go to cover, more and more every year and more expenses. And that's certainly a challenge. There have been instances over the last couple of years where we have received additional funding for specific projects, largely around like forensic programs or particular initiatives to support individuals coming out of the state hospitals. And that additional funding is helpful to get those programs started, but eventually those programs will have the same issues as our long-standing programs, in that if the funding doesn't go up, like the costs go up, like nothing stays static, and that continues to be a problem. And then particularly, like you've also heard a lot about like braiding funding, like that's been a newer initiative to try and make everything go a little bit further, is to braid different funding initiatives and really sort of stretch out what can be spent. One thing that we did, you can see on the slide, that did happen this year was the state budget included a $20 million increase across the entire state for mental health services, and for Bucks County that worked out to be an additional $745,000. That funding is called non-block grant funding, meaning that it didn't come through the block grant, but it's supplemental funding. But it's categorical specific funding, which means that it can only be used for mental health. So it doesn't have the same flexibility as some of the other block grant programs. And I think that's pretty much it. I'll turn it over to Amy.
Thank you, Jen. I'm here to talk about the Human Services Development Fund. My department, the Human Services Department, manages this fund. It's just over $400,000 a year, and it's more flexible funding as opposed to these other categories where maybe their spending parameters are more rigid. So our funding, we support programs that really promote and encourage an individual's independence, self-sufficiency, filling in the gaps. It's not directly spent on housing or mental health. We provide services, or our providers provide the services to, once someone, like let's say a client needs housing, well, they need not just housing, but they need the life skills to be able to get that housing, maintain that housing, maintain a job, get a job. So in fiscal year 22-23, these funds supported over 2,000 people and their families with some wonderful programs. AHTN, Advocates for the Homeless and Those in Need. They provided, this funding provided Code Blue shelter, supplies and programming, transportation for clients to get to those shelters. Let's see. These funds go towards BCOC for their case management, helping people out of homelessness, the life skills involved to be self-sufficient. The housing group, same thing. Women and their families who are facing homelessness, how do they get out of that situation? It's, as we've seen, it is the number one thing. And it's not just getting out of it, it's then maintaining it and having all the tools in your toolbox needed to do that. Catholic Social Services, again, life skills counseling. FSA, we give money to FSA to help run the information and referral housing helpline hotline. So important. Sometimes it's that step, that first step in someone finding housing. Liberté, women with families who are in recovery from substance use disorders. How do they get back on their feet, find a job, be able to raise their children healthy, healthy relationships with their kids? They're already facing a big issue. So kids are a big issue for anyone. So that's huge. Worthwhile wear, life counsel, life skills, financial literacy. That's for women who have escaped human trafficking. So that's even harder. Sometimes these girls are now women who have never learned any life skills at all. So they are starting from ground zero. So the HSDF funding really fills in some of these gaps and helps people get out of these situations that they might not otherwise be able to get out of. So we're very proud of that. And like the other funding, though, it's flat. So these providers have to do less, do more with less, essentially. Same amount of money, but it doesn't go as far. So with that, oh, I forgot to mention aging and their daycare programs, the adult daycare and personal care programs that they run. So thankful for that too, because that helps our aging adults be more independent, have a better quality of life. And also, Drug and Alcohol Commission uses some of these funds. And I will let Diane tell you about their, their services and what they do for the community. Thank you.
Thank you, Amy and Jen, for highlighting the financial snapshot. I think we wanted to make sure we spent a little bit of time talking about that this morning. And again, it's with flat funding, it's difficult to maintain programs and then also respond to when there's increased need. So thank you both for presenting on that. And Diane, that was a good segue over to Drug and Alcohol Commission.
Thank you. Thank you very much. The Drug and Alcohol Commission's share of the Human Service Block Grant is about $1.9 million, and I'm going to share some of the information regarding the use of these funds through the Drug and Alcohol Commission. Font is extremely small, so I'm going to just go ahead and read through this for you because these are important goals that we've worked on over the past year that we know we've acted upon and have impact on the community. So the first, of course, first and foremost, I should say, is to reduce fatal and non-fatal drug overdose in Bucks County, to ensure that residents are aware of our services, to increase access to treatment, case management, mobile engagement, and housing, to address disparities in the community, to increase collaborations, and to ensure the quality of the Bucks County Opioid Settlement Fund oversight. As we begin to talk about the impact of drug use in Bucks County, it's so important to start with the point in time that we're at in Bucks County, certainly Pennsylvania and nationally, and that is a depiction of the overdose fatalities over the last several years. Again, I'll run through them because I know it's challenging to see. But this information is provided by the Pennsylvania Department of Health. I'm happy to share it with you today because it's important information, with one caveat, and that is that the data is not fully finalized yet. Although it appears that we have the past year, 2023's data, what generally happens is that there are additional findings once the year has ended because of some protocols. And so these are not final data points, but I do want to share with you, excuse me, where we are. The peak, and these are Bucks County residents overdosed in Bucks County. The peak, unfortunately, of the opioid crisis or the drug pandemic was in 2017, where there were 259 overdose fatalities in Bucks County, 243 in 2018, 205 in 2019, and like most other counties, we had an increase mostly due to the challenges of isolation and the challenges that the pandemic brought. In 2020, the increase went to 214 individuals, then began a reduction, as you can see, which is certainly the direction that we're committed to. In 2021, 185 fatalities, 2022, 174, and in 2023, 138 overdose fatalities. A couple of points. It goes without saying, one overdose fatality is too many, and we are committed to 0 in Bucks County, of course, though it is encouraging to see the trajectory that we have right now. That's really important. The other point is that the coroner findings show us that there's not really one drug that people are overdosing from, right? I think years ago, as we saw the trajectory increasing, there were significant, for example, heroin overdoses. But at this point, there are many drugs in people's systems, unfortunately, when they're overdosing. So we've heard of an opioid epidemic and a focus on heroin, but really we're focused on all drugs of use. And so it's important to say that, of course, heroin, fentanyl, now xylazine, methamphetamine, all drugs that we're addressing in Bucks County. That said, the primary drug of use that people report that we're funding, individuals have to report on what their primary drug of use is alcohol. And so we just want to make sure that we maintain that focus on alcohol as well. The goals that I spoke of earlier, I just wanted to share a couple of words on the progress of those goals. So we've revised our own website to be more inclusive of community and family members, and that wasn't just a good idea that we had, it was feedback that we received from community members and from family members who had relatives who were struggling and challenged with substance use. So we think we've developed a website that does just that, but we welcome you to take a look at it, and we're really interested in your feedback. bcdac.org. We increased our own social media presence. It is challenging for individuals to know where to start with drug and alcohol services, and so though we feel like we do a good job of impacting the community, until someone really needs the service, they may not know where to turn. So we've really increased our social media presence. We've done that by developing our own marketing committee and a marketing plan that is doing just that. We've supported creative media campaigns, including our medication take back, underserved populations, increased treatment access to all populations in the county. Aside from housing that we've heard so much about the challenges of housing, I'm sure you'd all agree that transportation probably runs a close second. And so this past year, we were able to develop a service through opioid settlement funding for individuals to receive Uber and Lyft rides through an organization, nonprofit organization called Danny's Ride, to ensure that residents have access to their drug and alcohol treatment, to medical appointments, to mutual aid meetings, to community volunteerism events, and developed additional community partnerships with hospitals, human trafficking organizations, criminal justice related harm reduction services. And lastly, we launched numerous opioid settlement fund initiatives and expanded current programming. And just a quick word about that. Certainly, the opioid settlement fund negotiated through the Pennsylvania Attorney General will bring, during this first wave, about $45 million to Bucks County. That's over a long period of time. That's over about 18 years. And so Bucks County has developed a plan for expending those funds through a balanced approach of prevention programming, treatment programming, and recovery supports. Those funds do not lay with the Drug and Alcohol Commission. These are county funds. They are in the county's bank account and are county managed, though the Drug and Alcohol Commission does contract with the county to manage about half of the projects, and the rest of the projects are managed through the Opioid Settlement Fund Coordinator, Shannon Kirby, and through the county. A couple of the projects that were launched, though, that are really important. So opioid settlement funds are meant to either expand upon programming or introduce new programming, not to fund current projects, because of course that wouldn't be allowable. But we've made sure that we've expanded treatment options to residents. So important for me to just take a second to mention that we believe, and we live every day, that there should not be a barrier, a financial barrier to accessing drug and alcohol treatment. So please contact our office. We've received expansion funds for opioid settlement funds to let residents access longer lengths of stay at different types of facilities, every level of care, and including recovery housing as well. We've expanded our mobile engagement services, outreach in the community, expanded our BCARES project that I'll talk about in a bit. The county has also expanded to ensure that residents who are inmates at our Bucks County Jail have access to the correct medications, to medication-assisted treatment, which is so important. And we've launched into initiatives to reduce harm for residents, including providing drug testing, drug checking strips and kits, and provided significant training to our provider network to ensure that there's support. A couple of data points, though, that are important beyond what I've already mentioned. Important to note that over the past year so far, nearly 3,000 residents have benefited from the Human Service Block Grant funds, and those have been through detox services, treatment and rehab, halfway house, inpatient detox, rehab, partial programs, significant outpatient treatment, methadone medication, buprenorphine or Suboxone, you may know. And over 2,500 people have received recovery support services, which includes case management and active mobile engagement services through these funds. So a significant slice of our funds have gone to assist individuals in that realm. So important. Lastly, in terms of our future planning for the next year, we will continue our expansion of harm reduction opportunities. There are going to be some residents who are so challenged with stopping use of the drugs that they're using, and we want to make sure that we're there to support them and to keep them safe, or as safe as they possibly can be, and well educated. We're launching a new project at the Justice Center just across the street, where we have hired an assessor who is going to be conducting drug and alcohol assessments on site at the Justice Center, referred by the judges for individuals who've been there for a court proceeding, and she'll be referring those individuals on to treatment if needed, and she'll be able to make the placement and hopefully seamlessly using Danny's ride to transport those individuals to treatment. There has also been, in addition to the opioid settlement fund, a Juul settlement, Juul the vaping device, and so we're going to be working with the county on establishing the parameters for our contract so that we can help to continue to prevent the use of vaping devices among the community, especially among youth. And we'll be providing technical support to the new stabilization center that Donna will talk a bit more about later on, and that is BrightPath, because it is just another great example of sort of our force multiplier of using multiple funding sources to support a much needed project in the county, and that's the stabilization unit. And that's it for me. Thank you.
Okay, remembered the button this time. Right. Jen and Amy gave you an overview of the block grant in general, but I do like to provide information about how many individuals we served through our block grant base funds in both mental health and intellectual disability and autism. During this current fiscal year, 5,607 individuals have been supported through our mental health based dollars year to date. Now, it's important to note that that number of individuals and through our block grant funding does not reflect all of the individuals in Bucks County supported with mental health funding. Our health choices managed medical assistance program in Pennsylvania actually supports the lion's share of mental health services in our community. It usually runs about 75% to 25%. But the block grant is for individuals who are not insured or are underinsured, or it's for a service that is not covered by someone's insurance. So an example of someone being underinsured would be someone with commercial insurance, and the commercial insurers do not participate in certain services. Crisis services would be an example. There are billing codes for crisis services through commercial insurers, but the credentialing barriers and to who is eligible to provide crisis services really precludes commercial insurers from reimbursing for crisis services. So crisis services are really on the back of medical assistance and county-based funding for all of our residents in Bucks County who access those services. Health Choices this in 2023, just to give you a comparison of the numbers, supported about 17.5 thousand individuals in Bucks County through Health Choices funding, representing hundreds of millions of dollars. Now, it's a little bit different on the intellectual disability autism side. You will see a relatively low number of 5.6 million allocated to intellectual disability and autism through our block grant funding. But the number of individuals supported reflects both individuals who received base block grant funded services, as well as individuals who are registered with our medical assistance waivers throughout the county. So the reason that we at the county register everyone, whether it's a base funded service or a medical assistance waiver service, is because our department is responsible for the oversight of all of these individuals, regardless of their funding source. So again, the medical assistance waiver funding is in the hundreds of millions as well. A little bit about prevention. I think this is something that we do very well with our mental health block grant funding. Of course, prevention efforts are largely on the responsibility of block grant based funding. We have crisis intervention training, which this past year we've trained through a couple of different trainings. We've trained 60 law enforcement officers fiscal year to date, so that every police department in Bucks County has at least one CIT trained law enforcement officer. So they are trained to be trauma informed. They are trained to have basic education and working with individuals with mental health, intellectual disability, autism, all kinds of different vulnerable populations. And many departments have 20% of their law enforcement capacity that have been trained in CIT, so we're proud of that. Question, Persuade, Refer is a suicide awareness and prevention community education program. We had 33 classes this past year of QPR, training 1,669 individuals. So we've trained physical education teachers. We've trained students at Bucks County Community College. We've trained staff at YWCA, just to give you a little bit of sense of how we're in the community, trying to give community members tools, raise awareness, and prevent suicides in our county. Mental health first aid is a little bit more of an advance suicide prevention training. We did 6 training sessions in this past fiscal year, 2 of which were for youth. There's a youth mental health first aid curriculum, and then 4 for adults. It is, okay. We've trained 95 individuals either through the youth or the adult training over the past fiscal year. And then I always like to do a shout out to NAMI. They are a huge recovery focused mental health and co-occurring substance use partner for us. They do peer support and family services, both online and in person. They do a lot around some of our underserved populations in Bucks County, such as LGBTQI, individuals at risk for suicide, veterans and the military personnel. They are doing peer support groups in our Bucks County Correctional Facility as well. And they started out largely doing things in the schools around their Ending the Silence program, which is for middle and high schoolers. They continue to do that, but this past year, they started something called Small Talk, which is for elementary school students, kindergarten through 5th grade. So that's been a great addition this year. And to give you a sense of their volume, on their helpline and calls and messages received, they are well over 30,000 for just this fiscal year. We're going to talk a little bit later about our diversion assessment, restoration and treatment center, which is for the forensic population. But I did just want to give some quick updates from this fiscal year. Other updates, we just finished partnering with county partners, community providers, public stakeholders around sequential intercept mapping. Sequential intercept mapping pertains to individuals who have serious mental illness and or co-occurring substance use disorders and reflects the different intercepts or points where those individuals can intersect with the criminal justice system. We last did this sequential intercept mapping update in 2016, and so much has been built out in our continuum of support since then, and yet we know so many gaps remain, so we felt it was important to bring folks together again. So we have not yet received, we all came together May 30th for an all-day workshop with some national facilitators who do this mapping all over the country and internationally, actually. And we are awaiting their reports and recommendations to which we all provided input. I also wanted to talk quickly about our wellness and recovery courts. We started our mental health court, which is now known as Wellness Court, back in 2021. Currently, we have 27 participants that are enrolled in the wellness court with about 15 people referrals for which we're going through the process for admission. We had our first 2 graduates back in January of 2024. The recovery court is a track under drug and alcohol, the drug and alcohol treatment court, and that's a co-occurring mental health and substance use court. So we have 2 different courts that are now under the big umbrella of drug court, but have different priorities in terms of what is more primary for an individual, mental health or substance use. So in the recovery court, which is more substance use forward, we have 14 active participants and three graduates. When we developed the wellness court, we also started to look at housing, which is such an important piece of individuals gaining recovery and stability that are in these treatment courts. So we first developed a men's house that has a capacity of 9 individuals. And since we developed that 24/7 supervision housing, we've had 16 men go through that. We have a current census of 6 individuals with 3 referrals being reviewed. So that house is always at capacity since it was developed. And then a women's house started in November of 2023, this past fiscal year. That house is a much smaller house. It supports 3 individuals, but the township approval was just gained, and they will be able to do some renovations that will allow another 2 women to be served through that wellness housing, women's wellness housing as well. And again, that's a 24/7 program for folks. And then last but not least, I do want to spend some time talking about our IDA system. We talk so much about mental health and substance use, and we do receive, as I said, millions of dollars through the block grant to support our intellectual disability and autism system. So some of the highlights from this year is our waiver capacity. I alluded to medical assistance waivers. There are 3 different medical assistance waivers that are available to folks who are eligible for the medical assistance waivers, and the guidelines and income limits are different for these medical assistance waivers than the general population for medical assistance. 2 of the waivers have financial caps. If you have a PFDS waiver, you have as an individual, you have a financial cap of $41,000 per year. If you have a community living waiver, you have a cap of $85,000 per year. And if you have what's called a consolidated waiver, there is no financial cap on the services that you would be able to obtain. So just a couple months ago, we received an increase in capacity for our community living and consolidated waivers. We received an additional 93 community living waivers, bringing us up to 282 individuals who are being supported through community living waivers, and we received an additional 15 consolidated waivers, bringing us to 726 individuals who are being supported through the consolidated waiver. The governor has also proposed additional waiver monies in his 24-25 budget. So if we get that increased capacity as proposed by the governor, we would be able to reduce our waiting list for consolidated waivers by 1/3. We have currently about, I think it's, I'm looking for my number here, which I thought I wrote in, but I think we are at about 72 individuals currently on our waiting list. Performance-based contracting is also something new this year that has been in development from the State Office of Developmental Programs. That will roll out for IDA residential providers in January of 2025. It is an effort to tier residential providers in terms of the quality and type of supports that they are able to provide to individuals. So it's receiving and has received this past year a lot of press. Many providers, you know, are worried about how they will score in terms of tiering. So there's been a lot of public comment about this, but the overall purpose is really to just ensure that we have quality providers for this very vulnerable population. There was an incredible increase in incidents among individuals who were residing in our intellectual disability and autism residential providers. Not, you know, I'm not talking specifically about Bucks County, but statewide. And the state really felt the need to incentivize good providers, providers who are able to be clinically enhanced, as well as we've all talked about the increase in complexity of individuals that we are supporting. So again, January 2025 for residential providers, and then supports coordination organizations will be the next entity that will be facing performance-based contracting after that. The state is also moving towards utilization management. You know, I've talked about these different waivers and people's financial caps. The way it works now is that, for example, if someone has a community living waiver, like $85,000 is automatically set aside for that individual. But there are many individuals who are not using the $85,000, yet the funding is tied up because it's been allocated to that individual. So the state will be moving to management by virtual budget. I'm saying virtual budget because the money for the waiver still won't come to the county. It'll still be at the state, but the county will be responsible for overseeing individual budgets and moving the money around so that what does exist in terms of resources can be used more efficiently, and there's not just money sitting in people's budgets that's going unutilized. So that will be a big shift as well. It'll be a shift back as well. That's the way it used to work decades ago, and then they moved to a different way, and now it's moving back to that. In terms of school in-reach, the county, with community stakeholders, has an IDA Quality Council. And this year they have started an initiative where they are going into schools to work with school staff and work with family members around early identification of individuals. So we're not hearing about individuals in need as they're graduating from high school. So we identify kids earlier who might need IDA supports, and also to help educate staff and families about navigating the system in Pennsylvania. It's very complex. Let's just leave it at that. So that's a great thing, and the schools are really liking that in reach. And then finally, with services, you know, we've been talking about braided, you know, programs and things, and I did want to mention two broad checks, which are actually Health Choices reinvestment plans, but base funding has a piece in them. And the one is an alternative outpatient program in a community living arrangement. So this is meant to support up to 4 individuals at any given time who are highly complex with mental health and intellectual disability or autism issues. And it provides 24/7 staffing with supports, and we're really trying to scale this to a place, during this pilot period where it's not so expensive. We had last year, or maybe it's even been 2 years ago, been doing this like for one person, at a time, but it was costing like almost $1 million for that one person. So we are trying to replicate the support, but scale it a little bit so we can get more bang for our buck. The other thing that opened this past year is a specialized outpatient program at Wood Services, which again is for individuals with mental health needs who have intellectual disability or autism. Since it's opened, it's served over 50 individuals this year, and the demand is really increasing. And I said that was the last thing, and it's not on the slide, but I did want to give a shout out to Project Reach, or Project Search, not Reach, Project Search, which we've again this year, we have 10 positions at the county here, through which individuals who are enrolled with the Bucks County Intermediate Unit can move to up to 3 different internships during the school year through these positions to gain experience, learn about what they might be interested in. And as I said, this year we filled all the positions that we have here. The 10 individuals went through various internships. 3, the school year just ended. 3 individuals are already being onboarded for competitive employment, either here at the county or in the community. And many of the remaining individuals are pursuing certifications and certification programs like cybersecurity. So it's really been a successful program, and all the departments that have employed individuals, it's really been a benefit to both the department and the students.
Great. Thank you, Donna, for your presentation. And I am really thankful for Project Search here at the county. It is one of excellent initiatives. So we are going to be wrapping up here in about 10 minutes, and we're going to play. There's 3 shared initiatives that I want to be sure we highlight, and our Bright Path Stabilization Unit that really has been just such a tremendous partnership between so many organizations, and at the county level, absolutely BHDP and the Drug and Alcohol Commission, and our key partner Lenape and Doylestown Health. So we're going to go ahead and play a video. We're going to see if we can make this magical playing from the PowerPoint happen. Do I hit it, Shelby, or? Okay, great. This week we broke ground on the Bright Path Center, and this is something we are So, and thank you to our communications department at the county for putting that video together. We've been talking a lot about braided funding throughout the last hour and a half, and this is absolutely an initiative that is coming to fruition here in the county because of multiple funding sources. So I'm going to let Donna speak a little bit more about this, but the video kind of showed an overview of what this center is intended to do.
Thank you. And I am mindful of the time here, so we'll really just try to provide some highlights here. This will be over a 23,000 square foot building. It will provide services to both adults and children. It's really unique in that we are integrating so comprehensively across mental health and substance use needs. So it will not only be a crisis walk-in center for individuals experiencing behavioral health needs in Bucks County, but it will also be a stabilization center. And that stabilization piece will have a crisis residential piece, so individuals who need longer term than just, that couple hours walking into crisis, who may need a couple weeks to restabilize, will be able to be supported in that crisis residential piece. It will also have substance use services, not only drug and alcohol assessment 24/7, but will also provide services like medication-assisted treatment, induction into some of the medication-assisted treatments, and also non-hospital withdrawal management as well. In addition to, and peer support will be heavily represented both from a mental health and a drug and alcohol perspective with certified recovery specialists and certified peer specialists. What makes this center more unique as well is that it will also house the call center for 988 services. So 988 is the national crisis and suicide lifeline. Lenape Valley will be becoming a regional 988 call center, so serving not only Bucks County, but a couple of other counties regionally. Right now, calls for 988 from Bucks County residents are actually being answered primarily in Western Pennsylvania, which is not a good setup in terms of really deeper knowledge about Bucks County resources. So we're excited to braid the walk-in center, all of the assessment services, providing evidence-based treatment right away, and then also having this 988 and mobile crisis capacity, again with the overarching purpose of reducing folks camped out in emergency departments, which has been a huge issue, especially since the pandemic, and also diverting individuals from higher levels of care, like inpatient treatment, reducing things like involuntary mental health commitment to inpatient hospitals. So I don't know if you have anything more, Diane, that you'd like to add? Oh, funding sources. Oh, the timeline, see? I got stuck on the general description. Timeline, construction is expected to be completed by December of 2025. Ground, as you saw, was broken on May 7th. We're hoping that we have a little more aggressive construction and are done sooner with that than December 2025, but that's what the engineers feel comfortable putting out there. And again, to Rachel's point about integrating funding and resources, construction and startup costs are being funded through county funding, through the Department of Drug and Alcohol programs, grants, grants through the Office of Mental Health and Substance Abuse Services, opioid settlement monies, and a non-competitive grant to which we just applied. Money has been appropriated for us, but we had to actually apply then for the funding through the Department of Justice, a community project grant. So again, we're really trying to be aggressive about tapping all funding sources that we can to expand services.
I think we're going to jump over to B Cares. Diane is going to speak about that briefly, and then we'll come back to the DART Center.
Thank you. I wanted to share some information, excuse me, about our B Cares project that you may be aware of. That is Bucks County, assess, refer, engage, and support. In Pennsylvania, there's a mandate through our main funder, Department of Drug and Alcohol Programs, that every county must have a service for folks who survive overdose. As we know, folks who have participated in some kind of overdose are at a much higher risk of a fatal overdose the next time around. And so we're there for those individuals to ensure that they have access to services if they so choose. The B Cares project is extremely impactful in Bucks County and is a true partnership. It's another example of a prime integration, I think. And so our office receives funding for this project, and we contract with 3 community-based providers in Bucks County, licensed drug and alcohol treatment providers. And they work with all 6 of our Bucks County hospitals. So a project that began as a focus on only folks who had survived overdose, which is an important population, has now expanded through additional funding to reach out to folks on a med-surg floor, in the ER, on any floor with any type of substance use related issue. It certainly could be an alcohol related issue, it could be an opioid, it could be any number of things, but it doesn't have to be just overdose related. And we know that that's impactful because we're reaching folks at an earlier point to be able to provide an intervention. And the people that are providing that intervention are folks that have lived experience, certified recovery specialists, who we know can be most impactful. Our partners include not only the hospitals, but other medical professionals, the treatment providers, community-based providers, and we've also developed 2 enhancements that serve to support family members called Family Connect, parents who have been there and are able to support other parents through their child's or their adult child's challenges, and also a project that is for healthcare professionals opposing stigma. Those are individuals who've been in the healthcare profession, who've had struggles with drug and alcohol issues, who meet with hospitals and other medical professionals to help reduce stigma, to share their story and how they overcame some of their barriers. It's been an extremely impactful project that is also focused on partnering with the Bucks County Health Improvement Partnership and the Bucks County Department of Health. A few data points that I did want to share that I think are so important, and we're looking again at how folks are impacted in our county through the B Cares project. The top line is total individuals seen in emergency departments. Over the last year, we've seen 775 individuals in Bucks County hospitals, an increase of 113 individuals over the prior year. Individuals seen on hospital floors, remember they're not just seen in the ER now, 641 individuals, an increase of 26 individuals. Total referrals made in Bucks County hospitals, 1,570 individuals with potential substance use related issues were referred. That's an increase of 114 individuals over the past year. And though it's a decrease, important to note, the total referrals that were refused by individuals were 132 as opposed to 166 the prior year. So fewer folks are refusing the project. We know that's because of all of you, the good work that you're doing, the word of mouth, the encouragement of folks to access services. And lastly, it's so important to include our treatment providers in this process. Most people believe that with a substance use or an opioid use disorder, the first step is to access an inpatient treatment bed. And that is not always the case. That's not always indicated. That's not always desired by the individual. And we want to respect individuals' choices. So, though we may want to recommend an individual access withdrawal management or a detox service or rehab, that individual may just not be ready for that service. And so we provide ongoing support. And this past year, with our increased funds, we were able to add mobile B-Cares services and 24/7 B-Care services for individuals who aren't quite ready yet. Again, we're continuing with our harm reduction philosophy to meet people where they are so that we can provide the best services. And we can really only do that with the partnership of our providers. So thanks to everybody out there. And that's it for B-Cares.
Thanks, Diane. And our final slide is the DART Center, which Donna will speak about.
This center is likely not new to folks. We talked about it last year, but we did actually break ground in August, and there is actual construction that can be seen at this point. This center, it's kind of interesting. It's almost the same size as the Bright Path Center in terms of being 23.7 thousand square feet. This Diversion Assessment, Restoration, and Treatment Center, which we're fondly calling the DART, not to be confused with the Transportation Service in Doylestown, will have 3 units within it. It is for individuals who have mental health or mental health and co-occurring substance use issues, and also are forensically involved in the criminal justice system in some way. So the 3 units will be a short-term observation unit where folks can come for up to 2 weeks. It gives entities like our magisterial district justices an opportunity to send folks somewhere when they have previously sent the person to incarceration because they were concerned about the safety of the individual in the absence of some place where the individual could immediately go for treatment. We will also have an outpatient restoration to competency unit that can serve up to 4 individuals at any given time, and then a 16-bed residential treatment facility for adults, which can be longer term, so probably around 9 to 12 months. Individuals could stay in that unit as they learn skills, become more stabilized, and transition into the community. This center is, again, for adults only. Our service vendor is Geo Services. And so across those 3 units, we have total capacity for 28 individuals at any given time. Construction and startup monies are largely being provided, again, by a Health Choices reinvestment monies, but we also are bringing county ARPA monies to the table, county base human services block grant monies, and we also have a congressionally driven HRSA grant, which is a Health Resources and Services Administration grant that we had applied for. And that also, like the Department of Justice grant, was a non-competitive grant, but the HRSA grant is the type for the DART Center. So again, you know, you can see through all of our different conversations how we're not only like braiding funding, but really thinking of individuals holistically along a whole continuum of support and trying to fill gaps in that continuum through these integrated efforts.
Thank you, Donna, for discussing the DART. And I think it's encouraging that Bucks County has so many kind of significant initiatives moving forward. So I want to thank everyone who shared a great deal of information today. about our Human Services Block Grant. I want to thank everyone who attended in person and virtually. And there is an opportunity. Would anyone like to share anything else in light of the comments heard this morning? I know it has been a lot of information shared over the last hour and 45 minutes. Are there any comments online, Shelby? No? Okay, great. And are there any in the room? Okay. So there's an opportunity for the public to send comments along. My email address, as well as Shelby Seiss' email address, is listed on this screen here. And you're welcome to send information along if you so choose. And again, thanks everyone for coming out today for our public hearing. We appreciate it.